You're listening to the Turn Autism Around podcast. I'm your host, Dr. Mary Barbera, and today we have a special guest, somebody else I met on TikTok recently with a huge following over there. Her name is Dr. Sarah Williams, and she is a BCBA-D. She has both a master's and a doctorate in applied behavior analysis. And she is also a Black woman. And today we talk about not only social media and her business in supporting families with and without a diagnosis, but also the unique challenges and obstacles of families who are Black and also professionals and especially BCBAs who are might be having some challenges in a mostly white field. So it's a great conversation. Dr. Sarah is really she produces very entertaining videos on TikTok. But when I got down to talking to her for this interview, she is a solid professional as well. So I love this interview. Hope you do too. Let's get to it. Okay, Sarah, it is so nice of you to join us today. Thank you so much.
Thank you for having me.
Yeah, so I do not know you well at all. We just began interacting. So why don't you tell me and tell all the listeners here about your fall into the autism world?
Oh, my fall into the autism world has been amazing for me because it was kind of ironic. I honestly needed to get a third job because I was in the process of getting married and I needed to finish my last semester of college, my undergrad, and I needed some more money. So I was able to get this position with this school, which it was an inclusion class. So some individuals were on the spectrum and some individuals did not have a diagnosis. And so I was there supporting this one individual who was like in kindergarten or something like that. And I just fell in love with this. And the teacher was like, well, how did you, like, where did you come from? You do amazing. I'm like, really? I do really good at this? So I was like, let me find out what this actually is and how I can excel and what are some things that I need to do. So I pretty much went to, should I get my credentials for kinesiology because I was going to do adaptive physical education, or should I get my master's degree in applied behavior analysis? And I chose applied behavior analysis and I've been in it ever since.
And you also have a doctorate in applied behavior analysis. And so where did you get your advanced degrees?
I got both of my advanced degrees at the Chicago School of Professional Psychology.
Okay, I know
people on there. Yes, but it's a lot. I went to the Los Angeles campus and I actually was one of the first cohorts for the master's program. And I think I would end up being like the second or third for the PhD program.
Wow. So you've been a BCBA since 2013, did you say?
13, yeah.
Well, I beat you by a decade. I'm 2003.
Ooh, nice.
Paper and pencil testings, which
I was just going to say that.
Really dating me, but that's okay. That's okay. So you've been in the field a very long time as well. And I recently found you on TikTok, and I know I had Mandy Grass on the show, and actually I found you through her page. So Mandy Grass, we can link her in the show notes for you. And you are connected with Mandy over TikTok. You probably don't know her, just like you don't know me.
Right.
And it's this whole other world. So you have over 200,000 followers. And when did you start? Why did you start on TikTok?
Yeah, so I started on TikTok because I was kind of playing around with social media. I was trying to figure out different ways to market my business. And I was like, oh, I really enjoy like the music aspect, the short portions of it, because I love music. That's kind of part of my life.
Yeah, you sing out your TikTok videos, which is
I do.
Cool, and lip sync. And your videos are great. We'll link down in the show notes how people can follow you and me on TikTok. But go ahead.
Absolutely, yeah. It's kind of, I was like, wait, I can like I could do my two loves, disseminate behavior analysis and do music stuff. This is amazing. Like I'm always in the car and I'm like that makes sense to behavior analysis. So anyway, so I kind of started doing that and I did a video. I did 2 videos because I was like, well, we can't really show clients. So how can I show skills and still be able to kind of like show it as a model and be able to explain to people like how to do something. And I was like, well, you do this thing called duetting. So let's duet it. So I ended up duetting this Two individuals, one about tantrums and one about biting, and they just went completely viral. So,
Wow. And you started when TikTok?
I started in November of 2021.
So we're coming up on a year, but that's pretty amazing growth. So yeah, duets are when you see somebody else's video and then you have something to add.
Yes,
And,
yes.
yeah. So does this take, I know how much it takes me and my team to produce every day. We produce content on TikTok and like, are you spending a lot of time on this?
I've gotten better and better, especially with TikToks because they're pretty quite short. And so it doesn't take too long. What I do is I usually will have a day full of like TikTok. So I'll just have a couple ideas I want to do and will just binge them and just have them in my drafts and I'll later release them.
Yeah.
So it does take time into kind of considering like what you want to say and how you want to say it because you have to say it in such a short amount of time. But for the most part, not too much.
And are you're finding other behavior analysts, I'm sure. Are you getting mostly positives or are you getting backlash? I know there's a lot of controversy about ABA. I've done 4 myths and truths about ABA. We've, been trying to educate people that there are instances where ABA is not what Sarah and I would be recommending, that they're calling ABA. And so do you get a lot of backlash or negative?
Not anymore. When I first started, it was very much like, ABA is abuse and you shouldn't do this. And, the autism community is not like this. But then I kind of befriended someone who people think is quite unique, but for me, I kind of really enjoy her because I really communicate her pretty often and in private, and she represents herself as an ABA survivor. And so we have really deep conversations. We go back and forth and have conversations about, okay, talk to me about this. She's like, wow, you thought about, I was like, this is kind of how I was always brought up as a BCBA. So for me, I've always been like trauma informed, culturally sensitive, and just person-centered, like, just being able to understand individuals and break it down, not just be just about behaviors. But so yeah, initially I got some backlash and every once in a while I'll get something, but for the most part, people just recognize that I'm just trying to show it in a different light, in a different way, and try to show it in the exact way and address some of the nuances that you see and realize that, it may not be for everybody. And that's not my job to convince you to get ABA, but my job is just to educate you about it. And if it's something that's going to benefit your family, then so be it.
Yeah. Great. So you work in LA and you have different jobs or you have your own business. Like, when did you start your business and what is that all about? Like, how do you support parents?
Yeah, I feel like a true LA person, Southern California native, you always do multiple things. You're always juggling something. So for me, I'm doing my own business, which is primarily focused on parent consultation. It's remote services right now. I'm navigating through the insurance aspect of it right now, but it's primarily remote. And I provide just direct support in regards to kind of troubleshooting, like looking at what are your values in life? Okay, what are we trying to do? What are some goals that we can put in place? And how can we promote behavior change, right? What you're looking for that makes sense for you and your family. So I do a little bit of that. But I also do some assessments for school settings. I do functional behavior assessments for school settings just to kind of keep me fluent in my behavioral talk and knowledge. And I also work for a regional center, which is very specific to California. I know there are a couple in different states, but it's primarily a California thing where it provides fundings for individuals with special needs. And it's free funding for them, but it could be through ABA or it could just be through respite services. It could be housing services. It could be anything that you want. So I do a little bit of that, but I am transitioning from the regional center to focus primarily on my parent consultation business. And
your website is what?
DocSarahNicole.com. You can find me everywhere with Doc Sarah Nicole, DocSarahNicole.com.
Okay. DocSarahNicole.com. We'll link that in the show notes as well. Yes. And you might get people reaching out to you from this. Okay. So you talked briefly about cultural and trauma-informed approaches, and for those of you listening, may not know that Dr. Sarah is a Black woman with a PhD and a BCBAD, and we
Yes.
have done a couple episodes. I interviewed Maria Davis Pierre, who was the founder and CEO of Autism in Black, for episode 99. And I also did a diversity podcast with Dr. Fumi Horner. That was 142. We can link both those in the show notes. But I do want to turn, because I feel like you have such expertise, just being from the, a minority population that, isn't represented, just and isn't, families that are Black are not as supported as white families. That is actually proven. And then also professionals in a mostly white profession.
Yes.
So what, just generally, let's talk about families and like, what are some of the obstacles and barriers that you have seen for families that are not white?
Yeah. So I would say the biggest, and I've been in different settings. I've been in the home setting, school setting, and the regional center setting. And I think the biggest difference is resources, the knowledge of the resources. And then from there, whether or not once they receive the resources, whether or not they're able to be accepted by their family members, that's also a thing. Because a lot of times in the Black community, we have stigmas. We're like, well, I don't know. We shouldn't get diagnoses because we put that on our record. They're going to now change us and talk to us differently. And we're just going to be mistreated, which has some truth to that. And then there's also the really strong religious aspect of the Black community. And it's like, just pray about it. You'll be okay. And then there's the trauma part of it. And that's the part that a lot of people don't talk about is we're just afraid that if we are part of something that is telling us we need to do something a certain way, and then we do that and it still doesn't benefit us, then does that make sense? And that's what I see the most struggle with the Black community. And I try to explain to them, and they are a little bit more open to listening to me because I'm a representation of them, that they barely see as well, especially in our field. There's not many Black representation, especially with BCBAs, whereas 10% of all BCBAs.
That's even from my experience going to conferences, I would have probably expected 5%, like literally. Yeah. And I mean, I'm not questioning your stats, but I mean, it is a very white profession.
Yes,
and it used to profession. And so, I'm glad that we're able to talk about this because you do represent and you do know the nuances. And just like I'm a parent, so families trust me, more so in some situations because I am a parent too. Mm-hmm. So, so you do see it's interesting about the religious aspect and the, don't want to diagnose and especially in inner cities, you also have poverty and, other things that are getting in the way, you might not have the education, the access to really, I remember when, I fell into the autism world, it was like, I have a master's degree in nursing administration. I'm married to a physician. I have written, multiple papers and emails. I have a computer. I had AOL access. I have a car. I have money for a babysitter. I have my parents nearby that can help me. And it's like, if this is what I'm going through, what is the mom?
Right.
English as a second language with no car and no computer doing? And that was way back, but I don't think it changed that much.
No, it really hasn't. It's just been a different year. That's the only thing that changes, right? And think about it, especially when you're talking about, populations that are in poverty. You think about all these services that we have, especially if it is ABA, there tends to be a lot of hours, and then use that paired with speech and OT and all these different kind of services. And who has time to do those, right? Like, and what time of the day do you have to do that? And if your schedule, your work schedule changes all the time, then what do you do? Because a lot of times ABA services are very specific. Okay, through 3 to 5, like we're very specific in our time because you have to
And
maintain.
you need usually, and at least when I participated on both the giving or receiving end, is you need somebody 18 or older to act as like the custodian, guardian of the child while ABA services are provided. And so there
Yes.
goes the 15-year-old sibling who's going to watch them till you get home from work. And so there's another barrier that I don't think we've ever addressed on the show, and that who knows how common these things are.
And then remember that in your household, you're already trying to do something different that the Black community probably is not questioning, right? They're like, I'm not really sure about this. So maybe your family members within your household itself are already kind of like, I'm not really sure. I'm not completely on board with this, but this is what you want to do. So be it. So it's challenging. It's challenging because you want to be able to branch out and do what's best for your child, right? That's literally what parents want to do. They want to make sure their child is okay. And especially within the Black community, especially with the Black men, the Black boys, like there's certain things that we can't do. Being outside in the community and you're stimming and no one understands what even a stim is. And it looks suspicious, you're already being profiled. It can have some concerns, or let's say you have limited communication skills and you're trying to communicate, you're not providing eye contact, you're doing those typical social skills that someone who is providing you with the command is wanting you to respond to immediately. They mean, and all these different things can get you, maybe potentially in some trouble. So those are some additional things that, as like a Black professional, I see as like, okay, so let's try to like see this. How can we do this? How can we adjust our support for you to make sure that we adjust your values, but also be able to represent you within the community setting and still feel like you're not in danger, to be honest. Those are some things that we really think about.
And that's excellent points, is that in terms of Black Lives Matter and police reform and, my son, Lucas, is 26 now. He's still, is not conversational. And in the past, he's had problem behaviors that have escalated to aggression. That hasn't happened, knock on wood. Always knock on wood, for many years. But, any child of any race, if they get to be 200 pounds and they're aggressive in the community, you're at major risk of all kinds of things. We did a show with a captain from a police force who does police education. We can link that in the show notes. I think we addressed the race issue there as well in that show. But if you're a Black individual with those kind of delays and issues and problem behaviors, you're very much at risk. And the other thing that we don't discuss much is, my books and my online courses and everything are for young kids or kids functioning as a young child. So moderate, severe autism, the higher functioning kids, quote unquote, because we don't really like to use those terms,
right.
High functioning versus low functioning, but the conversational kids, the kids that can go out into the community by themselves, or maybe even drive, but don't have like really great problem solving skills, are also at risk, white or Black, but more so Black kids. Because like you said, the eye contact may not be great. They may be stimming. They may be stimming when they get upset, even though they are in a junior college, and
absolutely.
It's so complicated.
Yeah. And I think when you're a parent or a family member of someone who has special needs or in the profession, we automatically get used to it, right? We're automatically give grace. We recognize who this person is. We're very accepting. But honestly, the world itself is not always as accepting as we would like it to be. So we have to kind of recognize that everyone is different, especially when we're talking about autism. We know there's a spectrum. Everyone has their own kind of view, representation of themselves. And it's important for us to recognize that not only are we needing to be sensitive with race and how that affects just us in general in our company, but how do we address specific behaviors and specific responses to other people? So it kind of reminds me, and I don't want to go on a tangent, but it does remind me of that one individual, and I cannot remember his name, but there's one individual, he went to a grocery store and he had a mask on, but it was like a full like ski mask, and he was Black, he was young male. And I don't necessarily know that he was on a spectrum, but he was unique. Let's just say he was eclectic and things that he liked to do. And he went to the store and they misunderstood and thought that it was a robbery or something. And he ended up losing his life over that. And the only reason why I say such prominent, like, example is to give people things of like, sometimes you think something so small and something so simple that if people knew him, they knew that, oh yeah, he wore that mask all the time. That's not a big deal for him at all. But to someone who doesn't understand and who automatically leads with fear or leads with misunderstanding, then it becomes this bigger thing that it doesn't have to be, right? So those are just added things that the Black community has to think about, in addition to how am I going to support my child, my son or my daughter in the school setting, at home? You know, how are they going to be learning? How are they going to be communicating? How are they going to be doing X, Y, and Z? What type of social, are they going to make friends? You know, like just the simple things that we normally expect or hope for our children. It's a little bit extra. Are they going to be able to make it home tonight?
Yeah. So what advice would you have for a Black family who has a child on the spectrum? Are there any strategies or tips or things that they could think about doing to help keep their child and their family safe?
Yeah, you know, honestly, I think it's kind of a staple in Black families already, but I think it's doing the same thing: educate, 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 and model. You know, like, okay, so what happens if this happens? Like, what can we do here, and what about this specific situation? And then educate the community. So, what type of things can we provide our support, our individuals to identify that maybe this individual has some additional needs to be supported. Some people use little cards and little placards. A lot of times they're a lot more discreet nowadays. They're not so obvious, like a large badge anymore, but doing those things when you are seeking support, when you are getting resources, making sure that your resources are actually geared towards your individual and your family needs, instead of just something that's on an assessment, just checking off boxes, right? Because sometimes in communities and in people running businesses, it's very easy to just, okay, we need to work on this, we need to work on that. But no, this is the core of my family needs. I'm afraid that if my son walks to school, X, Y, Z, my son is aggressive in the community setting. We really need to work on that and decreasing that so it's not misunderstood. And I think that's my biggest thing would be communicate, seek resources, communicate with each other within your own community, but with other communities too, because in those resources, you may not be able to reach within your own limited community.
Yeah. I think that's great. And I love, educate yourself. And it's like, with my courses and my book, I actually want to read this stat from my book because it really does illustrate that families, Black families especially, are not getting the early access to diagnosis, not getting the early intervention they need. So this was a paper with Dr. Ami Klin and colleagues. It was pretty recent, 2020, I believe it was published, and I reference it in chapter 1 of my book, Turn Autism Around. And this paragraph says, sadly, the situation is much more critical for children of color because on average, they're diagnosed and treated even later than white children in the United States. A recent paper reported that 27% of white children with autism spectrum disorder also had intellectual disabilities, and that's an IQ lower than 70. Mm-hmm. While So 27% of white children, while 47% of African American children and 36% of Hispanic children with ASD also have intellectual disability. So the rate for having intellectual disability is almost double for Black children. And that's very scary. And it's not because Black children have a special gene that causes intellectual disability. My son has intellectual disability. I did a blog on intellectual disability. Even if you do the best of the best treatment as early as possible, there is a chance that your child will not progress in some areas and have an intellectual disability. I also know people with autism who have an intellectual disability, an IQ of 60, for instance, that are driving and, going to junior college and probably going to get married. So it's not like a clear cut, this is going to destroy your life. And it doesn't have to, obviously. I am all about, it doesn't matter, but the fact that it's twice the rate or almost twice the rate for Black children means that they are not getting the early treatment. And I'm all about, like, learn yourself before a diagnosis as early as there are delays, because it might be early signs of ADHD. It might be early signs of giftedness. It might be COVID shutdown and you're isolated. It could be, drug abuse or fetal alcohol syndrome that's mimicking something. But all of these strategies are positive, child-friendly, and we just have to help families of any race. I mean, we have people in my community from over 90 countries. So it is like all different languages, all different races. I mean, here we're talking about Black and white and Hispanic, but I mean, if there's a will, there's a way. If there's a mom or dad out there or grandmom or somebody that can learn, then reading my book, attending a workshop, and considering joining my online course is really going to get you, farther along. Not that you don't need professionals, because you probably will, especially if you get a diagnosis of autism, but there's a lot you can do even without a diagnosis.
Absolutely. Absolutely. And I think not pigeonholing yourself into one little thing. And I think two things are worth noting too with the statistics with Black community as well is, one, it's the hesitance to seek support or to seek help from specific professionals, right? We're used to being within our community, one, right? So then when you get a diagnosis, it may be later on, or you may have not gotten all the early intervention, which we all know that early intervention is very beneficial. But also it's the test taking too, right? A lot of these are standardized testing. And if some of the things aren't really understood by certain communities, or certain things are taken maybe a little bit more literal or less literal, and it's important to recognize that all these standardized tests doesn't necessarily meet the requirements of what it's supposed to be or what someone's response is supposed to be. And we see it all the time. People in the Black community get misdiagnosed, especially Black women in the autism community are misdiagnosed all the time, right? People don't see it because it presents differently in different races. So that's also something to think about. So it's not something that's always easy to accept. I haven't met anyone yet in my life that wants their child to be diagnosed with anything. Okay. But I do think that sometimes it does help and provide that answer, that maybe someone's seeking. But I do think that it's recognizing that not every culture is going to respond the same. And it's not just the Black community, it's the Black and the brown community. I see it with a lot of different cultures. I have conversations with one of my Korean friends as well. She's like, you know what, that's very similar in our field, in our community as well. I'm like, oh, wow, okay, that's good to know. But I guess my point is we have to recognize that stats they're a reason, right? There has to be some truth to it. So why is that? And how can we get to the bottom of that? And why is it more prominent in certain cultures and communities than it is in others? And how can we work on that? How can we help and support that community?
And I agree. And it's just a matter of, if you're a parent listening, or if you're a professional listening, doesn't matter what the race is, get parents to really say, you don't even have to like stand in line for a diagnosis. There's just a lot you can do to really
Yes,
um, get moving with trying to increase talking, decrease tantrums, improve eating, sleeping, potty training, like that's my mission. And I know that's your mission too, Sarah, with working
absolutely.
with and without a diagnosis. So let's switch gears a little bit in terms of Black professionals. You said there's 10% of BCBAs who are Black.
Yeah.
And so what kind of supports out there, or what kind of how can we get more Black individuals in the field and knowing about it? And
You know what? I think representation, I think that's also why I've been successful, with social media and things, because people see someone that looks like them and is doing something similar to what they are doing, or something that they're looking into doing. And they're like, okay, nice. Because sometimes we go to these conferences and we don't necessarily always see a representation of ourselves, especially when we're sitting on panels. We go to a lot of different symposiums and it looks different, which is fine because we're just looking at more research. But I think look into your community as well. There is a conference, BABA, Black Applied Behavior Analysts, which is a new and up and coming conference that has a lot of representation of us. All the presenters were of the Black community, except for a few. And also it's even inclusive too. So it's not necessarily you have to be Black or you have to be of a certain race in order to be part of it, but it's just a different perspective of being able to see your representation and be able to have that community and feeling like you're a part of something and you're with something. And looking at the statistics, at least on the BACB board, I was like, wait, only 10%? Like that can't be true. Someone had told me that, and I went and looked and I was like, wow. And everybody identifies as different things, but to be in a profession that used to be all male dominated, okay, and all white male dominated, and being a woman and Black and trying to recognize that, am I in this field? Am I in the right field? Should I continue to be doing this? Am I really helping? And to see that people just reach out to me and say, hey, I see you. Thank you. I think it's really important. So I think it's just continuing to reach out, continuing to collaborate. I mean, that's just really how our field works anyway, is through who you know and how can you connect and make new relationships and things like that. And I think that's just really what it comes down to. And it doesn't necessarily matter what race you are per se. It just really matters that you're doing good work and you're doing quality work to support others, for sure.
Yeah, I like that. So let's talk about advocacy. That's on your bio, is having expertise in that area. What do parents and professionals need to do to advocate better for their kids and their clients?
Yes. Okay. So I've been in meetings and settings with a lot of advocates, right? A lot of individuals that call themselves advocates, and sometimes it's extremely combative. And that's not the way. That's not it. I've learned when you're in a meeting or a setting and everything's combative or back and forth, a lot of stuff doesn't get said and done, and we miss the purpose. So my key things are: one, have the individual that you're advocating for being the upfront foremost person that you're always bringing the conversation back to. And then I like to do an easy method of what's the problem, why is it the problem, and how can we fix it? I find that if you always go with those 4 little thought processes: who are we here for? What's the problem? Why is it a problem? How can we fix it? A lot of the people in the room are always willing to kind of come together. And because it leads more of a logical, direct position compared to an emotional position, right? We're all human. We're all passionate about something, and we all want to make sure that we're heard in that particular setting. But if it is presented in a little more combative way or a little bit less collaborative way, it sometimes is not really received really well. So I find that being able to kind of communicate, what is my values, what is our ultimate goal? Okay, this is what it is. How can we get to that solution? What steps do we need to do in order to get to that? It goes a long way.
Yeah, I love that.
Mhm.
How about collaboration? We've both seen some pretty great collaboration and some pretty bad collaboration. It kind of
Yeah.
goes hand in hand with advocacy, but do you have any additional tips on how can we collaborate better? Is it just putting the person at the center, figuring out what the problem is, or are there additional
Yeah.
things to think about?
I would say when it comes to professionals, I think the additional thing is stepping aside and realizing it's not about you. It's really about the individual. And although that maybe you have something to provide that is of input, you say it, you present the information, you explain to them why it might be beneficial. But if the other individual, the person who is receiving this information, is not willing to take it on, then be okay with that. And I find that a lot of times professionals are like, no, but I know this is going to work. This is going to be great. And you're like, why aren't they doing this? And I find that once you kind of step back and realize that, let's just pause, and it'll come eventually. It'll be part of that. And I think with professionals too, as long as we're not very, no, this is mine and this is yours. And we're more like, okay, so how can your field help my field? Okay, I see, I understand. So we're working on similar goals, like the behavior analyst and speech community, right? We work on similar things. We work in communication, but there's certain aspects of speech that I don't know about that I need your expertise on. And there's certain aspects of why I'm teaching a specific skill about functional communication. So why can't we just talk and have a conversation about it and then blend? And honestly, the best and the quickest progress that I've ever seen with individuals is when all the professionals collaborate. And then once the professionals are on board and the family sees that all the professionals are collaborating, then the parents are on board. And then therefore you just have this beautiful team that is just doing nothing but focusing on our ultimate goal, which is that individual, and giving them what supports they need.
Mm-hmm. Yeah, I often hear like, leave your ego at the door.
Yes.
Coming into an IEP meeting or a collaboration meeting at all. And I like your answer to the advocacy question. Really just keep bringing it back to this particular student and this particular family.
Yes.
I said it in one of my recent interviews is, the parent may only have one seat at the IEP table and there may be 6 or 8 professionals, but they should have 50% say at least. They are the ones that are in it for the long run. And we have to not just consider the child, but also the family values and what the family wants, no matter
Absolutely.
who they are,
Yeah, absolutely. I've always was, yeah, absolutely. I've always was told that your client is everyone. It's not just the individual who's receiving services. It's the family, it's the parents, it's the caregivers, it's the grandma, it's whoever is part of that process. And if you look at it that way in a more broad setting, then you're realizing that, okay, it's the whole. You're looking at the whole person and not just compartmentalizing certain things.
Yeah, great. Okay, well, this has been super helpful. I'm sure to listeners, it's been a great discussion hearing your insights, Sarah. I'm really glad that you've been able to be on the show. And I like to end each podcast the same way. So part of my podcast goals are not to just help the kids, but also to help the parents and professionals listening be less stressed and lead happier lives. So what tips do you have, self-care tips, stress reduction methods that you use for yourself to keep your stress at bay and to lead to happiness?
Now, music is number one. It is always my number one go-to. I listen to a wide range of music. Just being able to clean my house and have the music on, sit in my car with the music on, that's number one. But the one thing that I have found that I absolutely love is getting a massage. I have a monthly subscription or prescription or to a place I get a massage. And the reason why I love it is because I'm completely shut off. It's just the phone's gone, the computer's gone, everything's gone. And I just get a massage and it's by 45 minutes of just silence. That is my best thing. Obviously, exercise is always great and fun, but music and massage for me, that's always been my go-tos. besides of obviously hanging out with my family and just cutting off work talk.
Well, I love that. That's a unique response. I had never had a massage. I have had massages, but I've never had that as an answer. I think that's a great idea, and for both parents and professionals. So I love that. Thanks so much for your time today. Everybody join Dr. Sarah Nicole. It's Docs Sarah Nicole on TikTok, Instagram, and her website. We'll link everything in the show notes, but I will be following you. I'm going to try to duet you soon.
Yes.
I'm newer to TikTok, so but I plan to collaborate with you in the future, and I look forward to seeing where you go. You're such a dynamo in the field, and it's been a true pleasure.
Awesome. Thank you so much for having me. This has been amazing.